Hi everyone, it's quiz time at the Funky Professor. Thank you for joining us this week. Can't believe it's another Friday already gone. So we have 10 questions for you today and a little bit of a mix-up. We're going to have 2 upper limb, 2 lower limb, 3 this week on the head and neck and pelvis. So if you're joining us, please let me know where you're from. It makes all the difference to know that I'm speaking to real people. So first question for this week. The adductor pollicis muscle is supplied by the median nerve. Now I'll give you a clue here. The adductor pollicis is in the hand. It's one of the muscles of the hand, and it's one of the muscles that supply the thumb because of the pollicis. But is the adductor pollicis supplied by the median nerve? So is that true or is that false? The answer is false, because the adductor pollicis is in fact supplied by the deep branch of the ulnar nerve. Now let me just give you a little bit more information about this muscle. So the adductor pollicis has in fact got 2 heads. It has a straight head, which is from the third metacarpal. So it's from the shaft to the third metacarpal. And it has an oblique head, which is from the base of the second and third metacarpal, but also from the capitate and trapezoid. So it has a sort of attachment from 4 bones, and it inserts onto the ulnar sesamoid of the thumb and the base of the proximal phalanx of the thumb. And so what it does, it adducts, or it brings back the thumb back to the rest of the hand. Now, just in case there's any confusion, I will just let you know about the other muscles. So these are the muscles which are in fact supplied by the median nerve. And there's a lovely mnemonic which is LOAF. So L is for the lateral 2 lumbricals. O is for opponens pollicis, which is shown here on the diagram on the left-hand side. Abductor pollicis in the middle, and flexor pollicis brevis on the right-hand side of the image. So there you have OAF for oaf in the loaf. Now, this can sometimes be a bit confusing because the movements of the hand is, when you think of, people often get flexion and adduction confused. Now, the way it helps me remember it is if you flex your thumb, or tip of your thumb, it bends that way. So when you flex the whole thumb, it comes across. So that's flexion and extension. But abduction, which is away, is that direction. So do you see? Ab is away and add is 2. So that's why you need those 2 powerful heads of the muscle to bring it back. We are adding it to the rest of the hand. So that's adduction. I've got a thumbs up, so somebody's here. I'm live. Brilliant. So let me just finish that with the opponens pollicis. So this movement here is opposition, where the thumb is touching the tips of the fingers. So extension, flexion, abduction and adduction. So let me move on now to the next question. So the rotator cuff muscles, that's what we're going to go on to now. So the teres major, is it one of the rotator cuff muscles? Is that true or false? Hi Faizan, nice to see you, waving to you. Do you know whether the teres major is one of the rotator cuff muscles? Is that true or false? The answer is in fact false. It isn't one of the rotator cuff muscles. Let me just show you a bit more about the teres major. So if we look at this muscle here, you can see it comes from the inferior angle of the lateral border and of the scapula, and it goes obliquely upwards around to the front of the humerus, the anterior aspect of the humerus. So there on the left-hand image, you can see the posterior view, and on the right-hand image, you can see the anterior view. Now, whilst the teres major may not be one of the rotator cuff muscles, the teres minor most certainly is one of the rotator cuff muscles. And you can see it here. It arises just above the teres major, but if you look carefully, you can see this one attaches to the posterior aspect of the humerus, to the proximal humerus, and the lower part of the greater tuberosity. And I'm just going to show you this oblique view here, so you can see how the teres major goes around the front and the teres minor goes around the back. And what that means is these two muscles have opposing actions on the humerus. So if one contracts, it rotates the arm inwards. That's the teres major. And if the other one contracts, teres minor, it has the effect of moving or externally rotating the humerus. So they're opposing. And I sometimes think of it as rolling a cigarette between your fingers, so it rolls one way and the other way. So the next question. Oh, just to finish off, in case you were wondering, the rest of the rotator cuff muscles are the infraspinatus, which sits just above teres minor, the supraspinatus, which comes from the supraspinous fossa, which is above the spine of the scapula. And then, of course, round at the front, we have subscapularis. So a nice mnemonic to help you remember that is SITS. So supraspinatus, infraspinatus, teres minor, and subscapularis. And if you've seen one of my videos before, you can, if you can go to our YouTube channel, I have a video all about the shoulder joint, and I describe the rotator cuff muscles like a jealous lover, because that's what they do. They hug and hold the humeral head tightly to the glenoid, tightly to the scapula, and they never let it go. So that's the rotator cuff muscles. Hi, Mohammed. Nice to see you here. Psycho Rhythm is here. Okay. Next question. The pudendal nerve. The pudendal nerve passes through the greater and the lesser sciatic foramen. Is that true or false? Does the pudendal nerve pass through the greater and lesser sciatic foramen? The answer to that question is true. It does. And let's have a look at it here. So here's the hip bone, the ilium, and there are two strong ligaments that attach to the sacrum and to the parts of the hip bone there. And you can see the pudendal nerve coming out of the top hole there, or top foramen, and that's the greater sciatic foramen, and it dives back in again into the pelvis through the lesser sciatic foramen. So let's take a look at this more closely. You can see here on the image on the left-hand side, this is now a posterior lateral view where you can see that pudendal nerve diving out of the greater and in. And just to show you and make it a bit more clear, you've got it now with an internal view on the right-hand image. Okay. And I just wanted to make it very clear about these two foramen. On the left-hand image here, you have the sacrospinous ligament, which is the shorter and smaller of the two ligaments. And then once you get the sacrotuberous ligament on the right-hand side, there you can see those two blue circles. So the upper circle is the greater sciatic foramen, and the lower circle is the lesser sciatic foramen. So how are you doing? Could you please put in the chat where you're from so that I know which country you're from and I can get an idea of whereabouts in the world we're reaching today. Next question. The medial border of the adductor canal is formed by the adductor longus muscle. Is the medial border of the adductor canal formed by the adductor longus muscle? Dr. Swetha, could you tell me? See if you joined us. Hello. The answer to that question is false. It is not. The adductor longus muscle is, in fact, involved in the adductor canal, but not on the medial border. So let's take a closer look at these borders. So the adductor canal is like a gutter almost on the anteromedial lower part of the thigh. And the superior border, or the anterior border, is formed by the sartorius muscle, which sweeps across obliquely from the superior iliac crest down towards the tibia there. And on the left-hand image, on the right-hand image, you can now see once sartorius has been removed, we can really reveal the other muscles. So laterally, you have the vastus medialis, which forms the lateral border, and then you have two muscles that form the posterior border, and these are adductor longus superiorly and adductor magnus inferiorly. So both adductor longus and adductor magnus form the posterior border, not the anterior or medial border, the posterior border. So why is this significant? Well, I just thought I'd share this with you. So the adductor canal contains two major vessels. These are the femoral artery and the femoral vein. Now, if you look closely at adductor magnus there, you can see that there's a little opening. And what happens is, if we turn this to the side, you can see that the femoral vein and the femoral artery, they pop through the adductor magnus hiatus, and pop through is a good clue to let you know that they change name once they go past. They pop through to become the popliteal vein and the popliteal artery. So that's a nice way to remember those. So, next question. Let's move on to the head and neck. The brachial plexus, which everybody loves, lies between the anterior and middle scalene muscles. Is that true or false? Aishwarya, can you tell me, is that true or is that false? Does the brachial plexus lie between the anterior and middle scalene muscles? The answer is true. They do indeed. And you can see here the anterior scalene, which attaches there to the clavicle. And if we turn it just around, I'm going to give you another image here. There, you can see it. If you look sort of anteromedially, you can see the anterior scalene and the middle scalene there's rising higher up on the cervical vertebrae, and between the two there lies the brachial plexus, and the posterior scalene is just behind it. Now, of course, as a shoulder surgeon, this is quite important to us, because when we're doing shoulder surgery, this is where the anaesthetist injects the nerves so that it numbs the whole arm, so that we can perform surgeries with the patient awake. So it's really changed the way we do these surgeries. Okay, let's move on to an artery now. So the inferior thyroid artery is a branch of the external carotid artery. Is that true or false? Is the inferior thyroid artery a branch of the external carotid artery? We'll get some answers through. The answer to this is false. It is not a branch of the external carotid artery. So let me show you a bit more. Okay, so if we look at the heart, you have the aorta that comes out. Now, from the aorta, you have the first branch, which is the brachiocephalic artery, and the brachiocephalic artery gives off the common carotid artery and the subclavian artery. On the left-hand side, it's different. There is no brachiocephalic artery. You have a common carotid artery as the second branch, and then the subclavian artery as the third branch. And you can see here that the inferior thyroid artery is, in fact, a branch of the subclavian artery. So let me just show you, just to make that a bit clearer. So on this image here, there you can see the right common carotid artery, and that splits into the external and internal carotid arteries, and the right superior thyroid artery is in fact the branch of the external carotid artery. The inferior thyroid artery, as we've just seen, arises from the subclavian artery. So let me look at this one now for you. So this is viewing it from the right-hand side, and there you can see the second branch from the aorta, which is the left common carotid artery, which gives off the external and internal carotid arteries, and it's the left superior thyroid artery that comes off this branch. Next question. So we're going to go back again to the neck. I was feeling quite necky this week, clearly. The internal jugular vein lies medial to the common carotid artery in the neck. Is that true or is it false? Does the internal jugular vein lie medial to the common carotid artery in the neck? The answer is, Mohammed, you got that? It is false. The internal jugular is lateral to the common carotid artery in the neck. So let's take a closer look. There you can see the internal jugular vein, and clearly it's very lateral to the common carotid arteries there. And what happens to this? They go on to join the subclavian veins to form both the right and the left brachiocephalic veins. And what you'll notice there is that the left brachiocephalic vein is in fact much longer and more obliquely situated than the right one. But both of these join together to form, of course, the superior vena cava that you can see there. So this is just to illustrate how on the left-hand image, there's a left lateral view, and you can clearly see that the jugular vein there is closer to us than the carotid artery, indicating that it lies more laterally. And on the right-hand image, it's indicating what it would look like from a right perspective, a right-hand view. Next question. The left renal vein passes anterior to both the abdominal aorta and the superior mesenteric artery. Is that true or is that false? If you know this, then you really are excelling in your anatomy, I do have to say. Does the left renal vein pass anterior to both the abdominal aorta and superior mesenteric artery? The answer to this is false. Because if we look in this image, the left renal vein, let's start again. So the inferior vena cava lies to the right-hand side of the abdominal aorta, this is where the renal vein joins it. And you can see from both the image on the left and the right that the renal vein does pass anterior to the abdominal aorta, but when it comes to the superior mesenteric artery, you can see that the left renal vein actually passes under it. So the superior mesenteric artery is anterior, and then the vein, and then the aorta. So what happens is, in this position, it's almost squeezed in between. So the renal vein can become compressed here, and this is known as the nutcracker syndrome. So you've got the vein now being squeezed between the two, and it's very rare, but it can happen. And when this occurs, sometimes it requires surgery, and you can either stent it, or you can just transfer the attachment to another place on the inferior vena cava. Next question. The falciform ligament attaches the liver to the anterior abdominal wall. Is that true or false? Does the falciform ligament attach the liver to the anterior abdominal wall? The answer is true, it does. And here's a diagram showing the falciform ligament, which arises from the umbilicus going upwards. And at the lower border of this is the ligamentum teres, which passes inferior to the liver. And the falciform ligament sort of divides the liver into the two lobes, the right and the left lobe. And you can see it here. It splits at the top to form the coronary ligaments, which then go on at either side to form the triangular ligaments. And this is the last question for today. At the hilum of the lung, so we're on to the lung now. At the hilum of the lung, the pulmonary arteries are situated inferiorly to the pulmonary veins. Is that true or false? Are the pulmonary arteries inferior to the pulmonary veins? Hi Prem, nice to see you here again. So is that true or false? Well, the answer is false, because the arteries are higher, they're superior to the veins. And this is a cadaveric specimen, and we're looking now at the right lung. And to the left of the image is the anterior part, and to the right of the image is the posterior part. And you can see in pink, the circles in pink, these are the bronchi. And then in red circles are the arteries, and below it in the blue circles are the veins. So now let's look at this one. So here again, the pulmonary artery is at the top, and the pulmonary veins are inferior. So you can see them. You can see them there. Okay, so that's this week's quiz. I hope that's been helpful. This week we had a fantastic presentation by Dr. Victoria Rose, who talked about the anatomy of the breast. So we've wanting to introduce clinicians now, and the focus of this is for you to get an idea of how we use anatomy, how we apply anatomy in our everyday practice, so you can see where all your studies, all your hard work, where it's leading. For some of you, you may have a very clear idea of exactly what you want to do, and you're focused on it. For some of you, and in fact for the majority of you, you're probably not quite sure yet which career choice you're going to go down. So that's why we wanted to give you some snippets of how people use anatomy. So let us know if this is helpful. Let us know if there's a particular specialty you'd like me to bring in. If there's some of you want to do cardiology, let me know. We'll get a cardiologist in, or a cardiothoracic surgeon. If you want to do urology, then we can, get a urologist in. You get the idea. So what we'd like to do at the Funky Professor, because this is not just about the anatomy, and for people who follow me on Instagram, you'll notice that I put up motivational quotes, because we just want you to succeed. We want you to not only enjoy anatomy, but to be able to just get through your exams so you can have the career of your dreams. Because when we help you, we know that you're going to go on and help so many other people. And that is just amazing and wonderful. And that's why we do what we do, just to see you succeed. So whatever we can do to help, particularly during COVID lockdown, I know things are quite tough, and a lot of you are doing distance learning. So hopefully this is a bit of light relief. Let us know what you would like us to cover. So coming up next week, we have Prof. Vishy, who's back in the house, and he is going to be talking to us about the pelvic cavity. So if you've ever wondered what on earth that pouch of Douglas, and seriously, who is Douglas anyway, you can find out the answers to those questions next week. And that's going to be next Wednesday at 5 o'clock. All you need to do is sign up. You can either go to our website, we'll be putting links there, and also you can sign up from our Instagram page. We'll be putting links up there this week. There'll be another quiz hopefully next week. Let me know if these things are useful to you. There's lots and lots of information, and new videos have been coming out on the head and neck series and our premium package. Seriously, these are, head and neck is complicated. I've got to be fully honest with you, but Prof. Vishy just makes it so easy. And I don't know how people, quite frankly, study it without having a good teacher. So he is here at your fingertips, at your disposal. You can turn him on, turn him off, and learn at your own pace, because this is all about you achieving your goals and passing your exams. So I hope that's been helpful. I hope you've enjoyed it. It is Friday, so have a great weekend, and don't forget, stay funky.